The Council of Medical Schemes has deemed COVID as a prescribed minimum benefit. So what this means is that no matter what medical scheme plan you're on, even if you're on a hospital plan, any treatment for COVID will be paid 100% by the medical aid at whatever the cost is. They also gave some guidelines in terms of COVID testing. So say, for example, you're not really feeling very well, you go to the doctor and the doctor feels that they want to run a COVID test. That test will be covered as a PMB. Say you go to the doctor and you're feeling actually really well and you have a test, but the test is positive, you will be covered under PMB. But if you go to the doctor, you say, look, I'm a little bit, just a bit nervous, I want to find out if I have COVID, I'm asymptomatic, they do the test and it's negative, that test is then not covered by the medical scheme. That you would have to pay either from your medical savings or from your pocket. So it's quite important to understand what is covered in this whole PMB thing so that you're not kind of caught unawares because apparently these tests are pretty pricey. The other one that I'm picking up as a big problem is that the hospitals are requiring people going into hospital for perhaps an elective procedure like a hip replacement. Anyone going into hospital has to have a COVID test. The hospitals are requiring this not for the patient, but to protect their staff. And this is where the medical schemes are bumping heads with the hospitals, because the medical scheme believes that the hospital should be carrying the cost of protecting its staff, not the member or the patient. The medical scheme also argues that as these tests are done several days before admittance, the patient could actually pick up COVID between the time of the test and going into admission. So it's actually not really that beneficial. And as a result, the medical schemes are not covering that the test, which costs about 850 Rand. Schemes are saying, if we keep paying 850 Rand on top of everything else, we're going to run out of funds pretty quickly. So that is a discussion that's happening at the moment. So don't get caught unawares. If you're going in for elective procedure, that COVID test is going to come out of your pocket or your savings.